Hello, friends. Welcome to we're going to call them break room chats. Remember when we used to do break room chats? If you've been here a while, and it was like things we would discuss in the break room. And then my sister pointed out we actually have people we could legitimately pretend we're discussing things with in a break room because now we have a panel. So we're calling these break room chats. We don't have an intro yet. Don't you worry. I will show you 8 million times when we do. But today with our break room, we are going to be discussing bullying in nursing, nurses eating their young, all of that good stuff that is actually not good. It's actually quite rough. We're going to be talking about what does it kind of look like? What does nurses eating their young / bullying look like? Because for a long time, there were things happening. And I was like, oh, there's no bullying here. And then I was like, oh, wow, that is some passive aggressive ish. And yes, I probably am being bullied. And then going through, do you report it to management? Do you not? Nurse Cal is bringing the hot take that is bullying even bad? So I'm excited for that one. We're going to explore it. And then what are ways you deal with it? So we have Nurse Scott here. So he's going to be our level-headed person to bring us down. And then I will explain to you how I go and try to rip people's throats out when they attempt to bully me and I fight back. So you can find a happy medium in between. We also have some new faces. There will be timestamps if you are watching this on the replay, and all of our wonderful panel members. You can find all of their social media info down in the description box below. So let us bring them in while we say hello to some people. Thanks for being here, and let's go. I think this one will be fun. So hello, panel members. We have a new face in the crowd. He's not new to the chat. We
Hi.
know him. Would you like to introduce yourselves?
I'm Chad. I'm a certified nurse midwife. I did labor and delivery for about 20 years. I did a couple years in the prison system, and been around the block more than once, I guess.
Scott. Well, welcome, Chad. Welcome.
Thanks.
We're glad you're here. Scott.
Hi, I'm Scott. I have the Nurse Scott YouTube channel. I'm an emergency nurse of many, many years, and working now to be a family nurse practitioner, working on my master's. The fall semester just started kind of today. So looking forward to this discussion very much. And for those of you that saw last time, here's my red toolbox that was referenced.
Yes,
I was a young nurse who wanted to save the world.
I love it so much. And Cal, that leaves you.
So I'm Murse Cal. I'm the nurse your parents warned you about, and I do long-term geriatrics and short-term rehab for the most part. Also, if you haven't watched the video that Nurse Liz did about the nursing shortage, that video was amazing. Highly recommend it. Please go back and watch that.
Well, thanks. I'll leave it linked down below. I appreciate that. And hello, everyone in the chat. Let's see who we have. Where is everyone coming in and watching from? Everyone I watch who live streams says that. So we're going to say that because apparently that's cool. Let us know where you're from. The person who's from the coolest place gets pride. That's what you get. Sophia, hello, welcome. Thank you for being a channel member where you get even more steroid-induced rage rant fits. Isn't that exciting? This is also a blanket statement. I had to go back on prednisone today. So we all know what happens to Liz when she goes on prednisone for poison ivy. I did bring Oreos to try to calm myself down, and coffee, which will defeat them. So that probably wasn't wise, but that's where we are. So if things were a little off the rails, Scott's going to pull out his toolbox and knock me out and help calm me down. Just like wave it and be like, Liz, stop. And yes, here we are. All right. Who has experienced, by show of hands on our panel and in the chat, Fairfax, Virginia so far is winning? Oh, Missouri, New Jersey. Depends on where you live in New Jersey. Dallas, Texas is too hot. That excludes you for today. Salinas, Kansas. Don't know where Kansas really is on a map, if we're being totally honest. Kansas and Nebraska get kind of lost. In my brain, Delaware wins because I went to school in Delaware. All right, Amy Joseph, you're a winner. Welcome. Have you been bullied, by show of hands, in your nursing career? Yes. Perfect. So would anyone like to share kind of what their experience with bullying and sort of has been in terms of, was it overt, was it covert, and kind of we can discuss the very different types of bullying there is in nursing, and what we have seen there. Come on, Liz, smack dab in the middle. I know. Geography and I, not friends. I grew up on the West Coast and then moved to the East Coast, and the middle is lost to me. Bullying, I have experienced the most in terms of probably at handover when you're giving reports. So I worked night shift. When you're giving report to the morning shift, and they would be really angry at you that maybe you were newer or you just didn't know and you didn't do something. And then they would try to like shame and belittle you and be like, oh my gosh, why didn't you do this? This is ridiculous. And then like they would just be very mean to you, right? When you're handing things off and you're like, I like literally just didn't know. And in the beginning, you just hide like you're just scared. You're like, oh my gosh, like that's really rude. And then as we'll discuss later in the stream, then Liz got a lot more confidence and kind of, I told the guys earlier, I kind of like honey badgered back at them with rage. And you can find your own way of like kind of battling it back. But that's when I experienced it the most was at handoff. And either they would cut you off in the middle of it, or they would yell at you for not doing something. And then they could usually retaliate if they were ever the charge nurse and give you crappy assignments, because that's also a way that people will retaliate is all of a sudden you have the worst. I mean, worst, you know what I'm saying? When I'm saying worst, no humans are like the worst. But if you have an assignment that's filled with 4 people who are just like filling up the bed with poop and are trying to get out of bed all at the same time, and then the favorite is over there with 4 walkie-talkies who are all just in for like, hey, I'm going to have some minor surgery tomorrow. It doesn't feel fair. That's been my experience with it the most. And if you've had experience, Norse Kirky said, I feel the doctors were the big bullies. I think this is going to vary on your institution. I've actually had nurses be a lot meaner to me than doctors. I've had one doctor scream at me only ever, which is not okay. But I would say overall, I worked at a teaching hospital and the residents were usually pretty nice. Like I think we kind of scared them. They had a little bit of a fear of us, but they were overall like, we didn't always agree, but they were not who I viewed as the enemy. I viewed day shift as the enemy personally. Carol Santos says, as a nursing student, I was assigned to an RN and she literally looked at her supervisor and said, I don't want to teach, no offense. And we're going to talk about nursing students one day. And we can talk about a little bit today how to deal with this. Don't take this personally. Nurses are really overwhelmed and having a student is also overwhelming. So would you count this as bullying, friends? I was going to say, yeah. I mean, I would say personally, I don't think it is. I think it's like very upfront and rude, but I think that's just a sign of overwhelm that person's like, I'm at my limit. I don't want to do anymore type of thing. Oh, also Melody's here. Hi, Melody.
Hello.
Do you want to introduce yourself really quick? We're talking about bullying.
Oh, I just wrote a song about that. My name's Melody. Well, for the purposes of Liz's shows, I kind of give the patient's point of view, and my passion is music therapy.
Awesome. Well, thanks for being here.
Thank you.
Scott, do you think the doctors are that would be bullying if you're like saying you don't want a nursing student?
It depends if it's because of something about the nursing student, like if they looked at them and said, oh, I don't know, because they're Latino or a guy or something, or if it was just like, I'm not in the mood to teach today.
Yeah.
Yeah. But it certainly doesn't make the student feel any better to say that in front of the student. No,
it doesn't make you feel good at all. And it's not okay. I think there's a lot of like, it's not okay to phrase it in that way, maybe in front of them. I get not wanting to have a student though, because if you're already overwhelmed and at your max, which is what we're seeing all the time in nursing, having a student, it slows you down. So, and that's not your fault as a student. That's just the reality of the situation. Nurses, we're not paid extra to have students, and we're not set up in a system where like the nursing school pays the unit to put an extra nurse or 2 on the unit, so that you could have less patients and actually teach well, which is kind of more of what the medical model does, right? They kind of pay to have more adjunct staff there so that they can have enough time to teach. We don't build teaching into our model, and the nursing schools don't pay anything. So you're just adding stress on top of stress, which is not the student's fault, but it's also not nurses' fault when you're kind of at your limit. And then they're like, here's a baby. And you're like, oh my gosh, like, now what do I do?
It can break up your routine a little bit if every day seems like the same thing. Suddenly having a student, you see things through their eyes and your focus is a little bit different. But you're right, you don't get paid extra for it. You don't get extra help.
Yeah, and it's stressful. So just remember that if you're a student and someone says they don't want you, it has nothing to do with you. absolutely nothing to do with you. It's like when someone doesn't want you as their nurse and they literally have never even met you. Like if they want to be that type of human, like it has nothing to do with you because they don't even know you yet. Right. So you're probably better off without them. And that's what I think with that. Any thoughts, Chad?
No, it sucks being a student.
Oh, it does.
Especially, and I'm going to go into this a little bit, especially as a male student.
Mhm.
The vast majority of nurses are female, and they're a lot more likely to take a female student than a male student, especially on a labor unit where I came from. It was always really rough for the male students.
Mhm. Do you want to give some examples of what that kind of looked like, just so other people can get an idea?
Absolutely. So I'd have nursing instructors show up with our students I work night shift as well, and I have the nursing instructor show up about a half hour or so before shift change, and I would go and grab the male students and say, "Give me your students," and I go introduce them to my 2 or 3 patients that I had and said, "This is Jeff. He's going to work with you today." And okay, fine. Day shift to come in. Oh, I don't know that they're going to want a male student. Well, they've already met. She's already said okay.
Yeah.
And I started doing that because before that, oh no, I don't think she's going to want a male student. Well, did you even ask her? No, I just don't think she's going to. You never even met the woman. How could you possibly know that? Her doctor's male. I was male. I've been with her all night long. How could you possibly say she's not going to want a male student?
Yeah.
How do you draw that line? Can you read minds? Do you have a crystal ball? Is there something that in the ethos that says that you know what she's thinking? So yeah, I would just preempt that one.
Yeah. And I think that's good. And we're going to have a whole conversation since we are very fortunate to have dudes on our panel. We're going to have a whole conversation all about, their favorite term is being a male nurse. So we're going to dive into that a little bit, dig through it, and decide why we need to specify someone's gender before their title. Because,
that drives me bananas too. I hate that.
Yeah. So I get questions all the time about, ironically, like people are like, can you tell me what it's like being a male nurse? I'm like, I don't think so. However, I know people that do now, so that'll be wonderful. So we'll have a whole panel discussion. Yes, Rick Evans, not a real nurse, a male nurse. Exactly. That's a very different NCLEX that you take. They're like, oh, wait, wait, the dude version. Got to get that in there.
It has sports questions on it.
Right.
No
What
wonder.
Scrubs brands make boobs look the best.
Oh my word.
A, B, C, or D.
Just to voice the other side of that, it has. I understand why it's bothersome. It hasn't really ever bothered me, mostly because I'm male and I'm a nurse, so it's not inaccurate. But it was funny because the only thing I remember about this is when I was a student, someone said, "Oh, so you're a male nurse?" And I'm like, "Well, I'm male, but I'm not a nurse until December." But people. They speak from their own experience, and if their experiences, they've only ever seen nurses as female, then you can't really blame them for saying that. But it is an opportunity to kind of teach them and say, you realize, boys can do this too. And,
Well, that's very kind of you to give them the benefit of doubt. I think they can do better. And I will attack them for you. And Chad, I'm excited to hear your perspective when we do that one. We'll make sure it's a day that you can come, because as a midwife, I would imagine that would be a whole different world
it's a whole different level.
Yeah, I imagine that would be a whole
level.
Yeah. I have had people comment in my chat before that they want to be a midwife, but they're male, so they can't. Like, as if like they're like, because you like literally can't. I'm like, no, you can't. Not literally. Like that. There's no. They thought because it was like midwife that they like literally couldn't. I was like, no. Oh dear. So I'm glad you're here. So back to bullying. Ways that you've seen it the most, so that we can kind of talk about ways to tackle it. Also, I love this comment. Underpaid nurse, you can tell which students are going to go Lord of the Flies in clinical and then become the bullies after graduation. I love it.
Breathe, Cal, breathe. I guess the ways that I've noticed it most is being the new kid on the block, and being the opposite gender that you should be, being the fish out of water.
Mhm.
Those are the two things that I've noticed the most as far as bullying goes in my realm.
Yeah, being new is really hard because people don't take well to it. And if you ask
Oh.
questions, then they're like, oh, you ask too many questions. If you don't ask any questions, then you're presumptuous. There's really no winning. Eva Light said the hardest is when the nurse doesn't have a teaching or coaching experience or relate to you. Funny that the first nurses in history were Greek males. Yeah, well, that would be, we don't like history. Okay. We don't like looking back that far. We only like from like the Puritan era forward here. Okay. In America. So please.
We're very Victorian.
If you think being the new kid on the block is hard, try being a traveler. You are a
Oh my
you are a
gosh.
guest.
That's a really good point.
You're there because I've had run-ins. I'm sure you can imagine. I've had run-ins with people. I'm like,
Mhm.
is that really professional behavior? Is that the way you're running things around here? It's like not realizing I'm a guest in their house.
Mm-hmm.
And it's not my place. You're here to just take care of patients and
Yeah.
that's harder for some of us than others.
Oh, for sure. And I would say that even like people who work as like a float pool, like per diem, even get that same, because I worked on a unit where the float nurses would just get like totally pooped on in terms of an assignment and the way people like would, they got those people and they're like, well, our nurses need a break. I'm like, well, if the per diem nurse is going to every unit and you're getting the patients that everyone just needs a break from, right? Like, or there was like not a lot of people wouldn't help people. So that's kind of some of the ways you can bully people in nursing is through your assignments that you're giving, or through lack of helping. You know what I mean? Like, so it's not always overt. It's not like, oh, like sometimes it's very overt and they're yelling or saying horrible things to you, but sometimes it's much less like you go to hang your head out the window and be like, can someone help me? And everyone is sitting there, but no one comes.
Like I see bullying as a combination of things. Because it's a term that I think has gotten muddied in a lot of ways. One is the intentional sort of trying to sabotage someone, which does happen, unfortunately. I think that this is complete BS and that those people should be stepped on with an iron cane. The second is when someone jumps down your throat because you either made a mistake that you should not have made, or you didn't do something that you should have done.
Mm-hmm.
This is something that personally I see as fighting for, the other nurse is fighting for two things. One, appropriate patient care. And in my experience, having been on the other side of that, it's fighting for new training or more training for that nurse because like they need more assistance and they've been let go into the wild a little bit too early.
Mm-hmm.
And the third one is just sort of like, we don't get along, so you're going to do your thing, I'm going to do my thing, and if you really need me, like if there's a code and someone's dying, look, I'll come and help. But anything short of that, like, you're a nurse, you can handle it.
Tough
And
love.
that's also bad, yeah.
Yeah. Yeah. So it can look like all sorts of different things. And it can also be just very blatant. Like you will have nurses who just say really mean things or yell at you and belittle you. Oh, good. Inner Light said, I just graduated about half of my clinical time. I was paired with travelers and most of them were great preceptors. I really bet they were because travelers are brilliant. They know so much. Like once they've been going for a little while, they know so much about, and they've seen other institutions. So just as a side note, find those people and listen to them because they've worked in tons of places. They know more than just the one way your place does things. And they probably need a friend because as we're learning, not always, but sometimes people can just be rough. Unless you work on Rick's floor. Rick Evans says, no, our floor nurses get a huge thank you and easy team of patients. So find out where Rick works and go work there. Okay. Because that has not always been my experience, at least on my floor. And I mean, it would be great if it was, but Clayton said, speaking of bullying, why are chronic non-cancer patients bullied so much and treated like they're misusing medications? We just did a whole stream on chronic care. I feel like that addresses that pretty well.
Along these lines, Liz, let's play a game called Did Scott Bully the Other Nurse?
Okay, I'm ready.
Yeah, okay. Here's the story. I had picked up, let's see, let me get my chronology straight. Nurse for the patient went home. The next nurse came in and had her for hours. And then this nurse her name was Liz too, actually. Liz came in and took up this other, she's a new nurse. Well, you wait till the story's over.
Oh boy.
So she came and picked up the nurse or the patient. And then with her other patient had a stroke. This is in the ER in case you didn't figure that out. And she went to CT with the stroke patient. So the patient that was left in the room was ready to go up to the floor. And I forget what I was doing, but I said, I'll take the patient up to the ICU. That's not a problem because you have to have a nurse go with the patient. So we're going through, we're getting the patient packaged up, as we call it, checking the chart. An assessment was never charted on this patient. And I had been in the doghouse for a number of things, people picking at all the work I've done. I guess that's a type of bullying we can talk about too, but I didn't want my name anywhere near this chart. Okay. So I called on the little vocera to Liz and I said, hi, Liz, are you in a place where you could talk? Like not in front of a patient. And I said, yeah, that patient that I'm going to take that patient up for you, but there's not been an assessment. Could you do that before we go up? And she's like, oh, I'm over here in CT. Could you do it? And I said, well, no, I don't think that's fair to me. I'm just volunteering to take the patient up. I know it's not fair to you either because the other nurse, should have done it, but then you took the patient. So we're not ready to go yet. So by the time you get back from CT, you can do that real quick. And by that time, we'll have everything ready to go, whatever. So I guess it all worked out. She came over, she did it, whatever. But then I got called into my manager's office, whose name was Liz too. What's the deal? So my manager called me and she said, Liz just was in my office crying that you yelled at her. And I said, wait a minute. I measured my words very carefully. And I made sure I wasn't embarrassing her by talking to her in front of someone else. I asked, are you where you could talk? And she goes, well, she felt attacked by that. And I said, well, first of all, I was very careful. Second of all, she's going to have to grow a thicker skin if she's ever going to work in this ER. She was only a couple months in, I think. And I said, some doctor is going to really yell at her and she's going to collapse. So maybe I did say something wrong. Maybe I did approach that the wrong way in putting too much on her at one time as a new nurse. She's with a stroke patient. Now she's got to come back and do an assessment. I don't know. So.
All right, team. Chat, what do we think? Everyone vote. Was Scott being a bully or was Scott not being a bully? I do not think Scott was being a bully.
No, he was not being a bully.
I think you communicated it well. I think some people take any criticism as bullying, and I have seen that line often often become difficult. When I was a charge nurse, people all used to come to me a lot and be like, oh, so-and-so was bullying so-and-so, or like they felt bullied. And I'm like, well, what did they do? And she's like, she said that I did it wrong and she wanted to show me the right way to do it. I'm like, well, that's not really bullying. That's just saying like, hey, just so you know, this is not correct. Like, let's move forward and I'll show you the way to actually do it. Like correction does not mean bullying. Bullying would be, like you said, in the middle, in front of people. I wrote that down as a point of anytime you're corrected in front of someone, like in front of your patient or in front of a team of healthcare people, and it's really belittling, like, hey, you're so dumb. I can't believe you didn't know how to do this. This is how you do it. And I've had people say that in front of me and other people. The first time I gave blood, I totally messed up the form and the nurse came in and she was like, oh my gosh, like how you can't get anything right. Like how dumb are you that you didn't even like, you had to send, did you send this form back? And I was like, no, I didn't send the form back. She's like, oh, like unnecessary. You know what I mean? Unnecessary. Not that you can never correct.
I guess that kind of is my point is it's also bullying is from the eye of the bullied,
that's a good point.
Sometimes they're being overly sensitive. And so
some people haven't been corrected a lot in their lives. That's why I think nurses who were, I mean, I'm very biased here because I was not an A student. So I think students that are used to failing were much more resilient because people have told us no a lot versus the people who get straight A's in school, pop out and they're like these perfect little sunbeams. And then life is like, and they have to get told that's not how this works.
Hey, Rick Evans in the chat said exactly what I was thinking. I've always heard you praise in public and correct in private.
Unless it's an emergency.
I think that
Like-
depends.
Yep.
Tell us. We love dissent.
So one of the things is that people operate in a lot of different ways, right? There are people who, one of the things that you need to do is, because they are so public facing, like, to give an example, I've worked with a CNA who will go above and beyond to try and do X, Y, and Z. And a lot of these things are good things, but there are also times to remember that, hey, look, you are working this specific area. You need to stay in this specific zone. A lot of these patients are critical. And so, or, if something happens, you need to let me know, like somebody needs to be on this unit. And if you're going to be off it, you need to let me know so that I can cover this area. And if you're going to look for somebody's random photo that's been packed up somewhere and you don't know if it's in their room or their old room or the other room or God knows where, then like this is not a project for now. This is a project for when you can get coverage for that area and when we have free time. Oh, and by the way, have you got all of X, Y, and Z done? Because one of the things that's important is that a lot of times we forget that there are priorities in healthcare. And in wanting to do the thing that, we can do this thing that will make our patient feel better, or we can do that thing, or we can do X, Y, and Z. Sometimes we forget that, hey, look, I've just spent an hour and a half with this patient and I've got 4, 6, 9, 12, 19 other patients or more that I've got to, do X, Y, and Z with. And, sometimes you need that, hey, look, you need to finish up with this patient because you've got other people that need you. And there are appropriate ways to do that in a public setting. And a public setting I consider where anybody else can view. And if you're doing it in front of a patient, if you're correcting somebody in front of a patient, there needs to be a very good reason why you are chewing someone out in front of another patient, where it's like, hey, look, you almost ripped out this patient's Foley. Hey, look, they have this central line. That's a big deal. Like, if it's not life-threatening, you don't need to jump down their throat in front of someone. Save that for using stern words elsewhere.
For sure. Yeah. If it's an emergency, you definitely need to. And I think that brings back what Scott was saying. Like, a lot of bullying can also be in the eyes of, some of it's just blatantly, but other times, if you are a really direct person, I have seen really direct nurses come across and be labeled as a bully when really they were just like, their form of communication was just very like, hey, don't do that. And they didn't mean it in like, no, that's not how you do it. You do it this way. And they did not mean anything by it, but it was just a huge lack of communication in terms of that's how this person communicated. And the other person wanted to be like, great job opening that package. Now, I do want to go back to the first part where you did everything maybe just a little bit wrong, but you washed your hands when you walked in, like compliment sandwich type of human. And then you run in and the person who's a compliment sandwich type of human goes to the manager and says, hey, this person's really mean. And we run into that. Someone had said who said Kate said, I had a new nurse go to my manager saying I screamed at her in the nurse's station. Fortunately, my manager supported me with this is a completely out of character of her, but I'll talk to her kind of thing where hopefully they know you well enough that they can kind of come to bat for you. But just being aware of how we say things and criticizing mostly in private is always an excellent thing.
The other way is also true, that some people are really more resilient. We won't play another game, but this is Scott did
I like games.
bully another nurse. I was at the end of my shift. I was tired. I'm giving a report at the station. And Elmer, I swear to God, that's his name. Elmer comes up and he puts a vial of medicine right down in front of me. He goes, was this yours? And I'm like, what? No, it's not mine. I'm like, I'm trying to give report. And I'm like, God, Jesus. So I actually went to him the next day, being an adult, and I said, Elmer, I'm really sorry the way I barked at you yesterday. You didn't deserve that. And he's like, yeah, don't worry about it. So for him, where that really should have offended him that I barked at him, was just like, it's not a big deal. You had a long day. I get it. Whatever. So,
and some of it,
the bullying are people being treated more harshly than they should be and more harshly than they expect to be? I mean, so it's a two-sided thing I think we're getting at here as we discuss this further.
Yeah. And I would say on a repeated basis, because I think we've all probably been working in healthcare, you work with the same people so often if you're on that unit that you have a pretty weird relationship with them, like trauma bond type of thing. And then like you can just like, it's much easier to snap because you know them pretty well. You've been together for 12 hours. You've been running around like a chicken with your head cut off. You just want to go home. And then he walks up and you're like, oh my gosh, like, are you kidding me? I think bullying, I would classify personally as more of a repeated thing. Like you do it all the time rather than someone being like, I don't like steroid Liz. I'm going to talk to her when she's done. With that moment, like, okay, something's wrong with that girl. We're going to come back later. And that might not be everyone's. And I was going to say this at the beginning, that we're all going to have very different opinions on this because the way people handle bullying is 100% different. Like no one has the perfect way. So we're probably going to disagree with each other or disagree with how you would want to do it. This is more to just give you an idea of different ways you could deal with it and then pick which one you like. Because there's no perfect answer here. Obviously, nursing as they're young has been a logo for like 50 years. So clearly the solution is not upon us.
If I might chime in here, I think as a society, as nurses for sure, but as a society as a whole, we forget that you're human. I'm human. Mm-hmm. We get to make mistakes.
Yep.
A, that's how we learn. B, maybe I just had a fight with my wife before I left the house. Maybe I just woke up on the wrong side. Maybe I'm just having a day today, and today isn't the day to approach me. And that goes both ways. You need to allow yourself to make mistakes and learn. I need to allow you to make mistakes and learn. I need to allow you to have a bad day occasionally. Like you said, Liz, if it's a chronic thing, that's different. And you need to allow me to have a bad day occasionally. It's just, we're human.
Yep.
We are people.
Yep, for sure. And I think remembering where you are too, Melody, I bet can probably tell us some stories. Have you ever seen nurses bullying other nurses or like healthcare people bullying from like a patient's perspective? And you're like, well, this is uncomfortable. Because I would have to imagine it would be very awkward. Like, because we kind of forget we're at work and like other people are there from a different perspective because we're like, oh, this is just like my second home. But that's got to be super awkward from a patient's perspective if like your nurses are fighting.
Yeah, the main experience that I had was when I was in my in a primary care's office, and he was just, I had only seen him as just the most gentle, calm, grounded person. And all of a sudden I heard this screaming, and he basically had assembled his staff, including the nurses, the receptionists, and everyone, and was just bullying and screaming at all of them that they weren't doing things fast enough for insurance guidelines and to speed up. And I was getting morphine injections at the time. And, the nurse was coming in and I'm like, are you sure you're like, okay to give me an injection, because I had heard, what she had just been through. And she was like, yeah, he's kind of upset. We're doing the best we can. It's, I was scared. I felt like, number one, it lessened my trust in my doctor.
Mm-hmm.
Even though he is human and humans have tantrums, I just still felt like, since this was the professional environment, that like, if you can't keep your emotions under control in your work environment, and you can snap like that on your staff, will you snap at me? Even though I'd had no evidence of this before. Mm-hmm. And then I also, as I said, I felt like less safe with the nurses just because I knew they were upset. And I was like, okay, well, if you're emotionally impacted, are you able to focus on what we're, on the procedure that you're performing at the moment.
Yeah, that's a good point. We're like, hey, if you're fighting,
Right.
what are you really thinking about for both nurses? Because the one is like, I want to kill you. And the other one is like, let me go cry in a closet. Like, I just need to get to the med room. I just need to get to the med room. And then I can have my breakdown. Dietrich Rimboli said, hazing is a terrible form of bullying too, and way too normalized. It makes you want to quit before you've even started. I'm lucky I have not experienced hazing in that way at work as a nurse. At Chili's, yes, but not as a nurse.
I was going to say you had lots of disqualifiers there.
Yeah. Chili's is the wild, wild west of the restaurant industry. Okay. Once you've made it, it's a great time. Have you guys had any like hazing type things? I feel like I'm sorry if you have, that's just miserable.
So this is more doctor to nurse situation.
Mm-hmm.
We had a doctor who, again, I'm working long-term care. The way that it's set up is that you have a primary doctor and a primary NP who will visit so many times per week. And then after 5 o'clock, they have an on-call rotation where the nurse practitioner or one nurse practitioner and one NP will be on call from 5 p until 7 a. And there was one doctor who I'm really tempted to give his name. Really, really tempted. And
make up a really good one.
Yeah,
like Ebenezer.
I just, Ebenezer sounds really, really correct because he was not the youngest person. And if you would call him about anything, it was, well, did you do this? Did you do that? Did you do this other thing? All three things are like 90% irrelevant. Like I know that, hey, look, you're complaining of burning urination. We're going to get an order for urinalysis with culture and sensitivity. And maybe if they're being really cautious, we'll get a CBC or this, that, or the other thing. Like a lot of standard things. And again, I work in a post-acute setting where like these aren't available really 24 hours a day. And 9 times out of 10 are stat labs. If I were to get a stat lab at 9 o'clock at night, I would get the results from the lab tomorrow morning faster than I would the stat lab. Doesn't make any sense to me, but whatever. But this guy ordered 3 or 4 different things. Then he wanted everything. When you were calling a report for a new admit, he wanted just the drug names, not the dosage or the frequency. He was very specific. Got to learn him really well. He ended up being fine. But the way that I found to counteract a lot of the problems personally was that I was as petty as he was. Okay. I am all for the pettiness. You know what?
Man.
If this patient was complaining of pain and they didn't have an order for PRN Tylenol, you know what? And this guy was on call, honey, I would call every time. You know what? If this person needed PRN, like if they needed something to sleep, they needed melatonin. And it got to the point that there was a person I had adult relationships with who was in med school, and I was like, look, the one thing that you don't want to do is you don't want to get in a fight with nurses, because we as nurses have very little power, but we are the kings of passive aggressiveness.
The honey badgers.
Yes.
It will make your life hell.
Like if we find out that you are on call, we will go 4 different steps to find things. And, when you found out that Dr. Ebenezer was on call, you would go looking for things to call in.
Yes, which some might even call a form of nurse bullying. Back on him, but I fully support it.
And eventually it got to the point that he realized that the reason why we're doing this is because, you're wanting 8 different things for something that you're just going to give one simple thing for. And like, we can cut out all these steps. Like, we don't need to do X, Y, and Z. And so I think that a lot of times people classify bullying as trying to alter behavior in a positive way through negative reinforcement. And this is one of those things that, you know, especially when it comes to new nurses, the example that I think of, there was a new nurse that I was accused of bullying. And I was like, look, I've told y'all multiple times that she's fresh out of school. She needs more mentoring. She needs somebody that she can go to and talk about. Like, hey, look, I've got X, Y, and Z going on. She started someone on oxygen to raise their O2 sat. Awesome. Great. Okay. Did she listen to their lungs? No. Did she call the doctor? No. Did she take any steps other than starting like oxygen? No. Like, this is a problem. Like, yes, I'm going to have a mini cow over you just starting someone on oxygen and not taking any other step. And there's a reason for that. It's because you need to go one more step. And that's my problem with bullying, because I think that a vast majority of things that are considered bullying are really, hey, look, you did a bad. And whenever someone tells you, hey, look, you did a bad, our initial reaction is, no. Even me.
That's true. Yep.
On the other hand, though, Cal, this goes back to what I was saying earlier. We all had a first day on the job.
Mm-hmm.
Not a single one of us were born knowing what we know. Somebody took the time to teach us. Somebody gave us the opportunity to learn. And so, and again, that goes both ways. You're the new kid on the block. You've had the first day on the job. You're going to go through some growing pains. And me as a mentor or a coworker, this is her first day, first week on the job. She's got to be able to learn. She's going to make some mistakes, and that's okay. It doesn't mean you're raining fire and brimstone down on her. We just pull her aside and say, here's what you could have done differently. Here's what should have happened better. Next time you come up against a situation like this, come find me. We'll work through it together.
Again, not explaining the entire situation. At this point when this happened with the oxygen, we're talking about like 6 months into the job. You know, like, and I love having nursing students. I love proposing situations to them, because the thing for me is that nursing school is really good at giving you the knowledge to know what you do, but not giving you the knowledge or experience to apply that knowledge appropriately, right? And like, proposing situations to people, getting to see how people think is really important, because sometimes people think in really interesting ways that you didn't think of. And that needs to be encouraged, even if how they're thinking is really, really wrong. You know?
Yeah, sorry, I was distracted. I was adding to the chat that we're going to play Is It Bullying for everyone. So we've taken Scott's game, and now we're giving everyone a turn, and we're all just going to give examples of our own situation where we've maybe been accused of things, and we'll just play Is It Bullying or Not. So everyone, was Cal bullying? Scott's calling you out and saying yes.
I think I would have to been there, but it would be a matter of the tone, the situation, and just, was he yelling and screaming, jumping up and down, or was it, you know, a learning moment? Another learning moment after 6 months. One more.
Well, are we talking about when I was thinking about when you're dealing with the doctor?
With the doctor, 100%. 100%.
Yeah. Oh, okay.
Yeah.
That's what I was thinking. I mean, it's bullying, but you know, it's a proud tradition.
But you know, it's kind of, we could add like bullying justice, kind of like when people are jerks on the road, and so you're a jerk back. It's road justice. So technically, it is counter-bullying, but it has justice mingled in. Mai says not bullying, but can use a better approach. I think it just depends on the way the person interprets it. I also lean very much into like, oh yeah, sure, I'll explain anything to you like 12 billion times. Just don't go in there and pretend like you know what you're doing. So I think it also depends on the people you're working, like the attitudes of the people working. I've also never worked in long-term care, so I can't really say from that perspective what it looks like. I think Kate brought up a good point. Thanks for the super chat, friend. I appreciate you. And I forgot about the OR. I got out of the OR training program contract along with 5 others because of hazing, because the OR does have hazing. My mom worked in the OR for a long time, and she many times said there were certain surgeons that she worked with that were absolutely awful. And she's like, but once you kind of got through like them testing every single like hazing you basically and being really mean and being like, how did you not know that? Once they put you through the paces and realize like, okay, you're probably fine, then you became much easier to work with. And I think that probably happens a lot in the OR, and that stinks. So if you work in the OR, let me know if that's, obviously, clearly it's still going on because Kate experienced it, but I do think the OR is probably somewhere where you're in more of like a power struggle dynamic type of thing where someone can make your life, when you're on the floor, you're not like, there's not like a physician sitting right there telling you everything to do. But in the OR, it's kind of like the surgeon and then you. And there is much more of a hierarchical structure there because one person is leading that boat. And that would be a mess. Melody James says hi. So, next question. Do we report to management when we are bullied? Let us know, chat. Do we report to management when we are bullied? Liz does not report to management when we are bullied. Because I feel like it does nothing. I know you're always supposed to, and they always say you're supposed to report things to management. I feel like, in my experience, it has not done anything except make the bullying worse. I would rather just go to the person and deal with it and then increase my pettiness level when they refuse to fix their behavior. But that's how I deal with it. So I don't go to management. Scott, your face tells me you don't agree.
Well, I haven't had to do it, but I'm thinking there's a difference between going to your manager and saying, Scott yelled at me, and going to your supervisor and saying, we're not communicating and we need a third person to help us find a better way to communicate. And hopefully you have a supervisor who has the skills to mediate that kind of thing. God knows there are good, bad, and the ugly in management. But it may be one of those things where it's like, look, you and I are just not, we're misunderstanding each other. And it's probably because we're too much alike. That happens a lot. People are too much alike. And the things that they see in others, that if I see it in you and it's pissing me off, it's because it reminds me of something in myself that pisses me off. Or anyway, sometimes it just helps to have a third person come in and mediate. But it depends on your supervisor if they're going to be effective or not.
And it totally depends on your admin, because mine has always been in the pocket of they're in the same in-group as the people who were doing all the bullying. Like, so day shift was not a good vibe. The people were not the kindest. And there was a lot of passive aggressive bullying where they just wouldn't help. They wouldn't do things. They would purposefully make things harder for you. Little things. But management was in there. They were all in the same little, they partied at the same lake house. They all were friends. So if I went and complained to management, then it was like, it was just going to get so much worse. So I think it does probably matter. And that's why I'm glad all of you are here, because you might have had very different experiences where you got invited to the lake house party and Liz didn't with the manager.
Well, maybe if you played your cards right, Liz, you get invited to the lake house too.
I only went to management about bullying one time, and it was kind of a less obvious thing. I remember at shift change, I would stand by the doors as the nurse would go in and she'd say, "Okay, I'm leaving. I'm handing off to the next nurse." And there's a couple of nurses that would say, "So you have a male nurse today. You don't want a male nurse today, do you?" And she'd come out and say, "Oh, she doesn't want you. We're going to change assignments." Okay, that's one. The next time that happens, we will go to management and we will be sitting in HR discussing this, because I can't go into a patient and say, "Well, you have a nurse of color today, or you have a obese nurse today." No, I'd be fired now, and we'll talk about it later. So why is it you get to go in and say you have a male nurse today? You don't want that, do you? You just set me up for failure.
Yeah.
So
that's
that was
very
the
true.
only situation that I ever went to management and kicked rocks. So.
And that was a good one.
Yeah,
was a
and that's a
choice.
very
If you had to pick your battles, that's a good battle.
That was it. That was it.
Yeah, Cal, you had big feelings. Do you want to share them?
Yeah, so there are specific things covered under, I'm forgetting whether it's Title 7 or Title 9 at this point.
9.
Nine. Title
Which
9.
is things that people can discriminate for or against. For example, you can discriminate against age in a lot of cases. Okay,
Up until a certain, below a certain age and above a certain age.
sure. But the thing is that race, sex, gender, ethnicity, nationality, religion, disability, like there are a lot of things that if you are going to discriminate on this basis, and you can say, well, we're not discriminating, it's customer preference. Well, you also can't do that, right? That's also not covered. This is one of those things that is a big deal, and I've seen it a lot with male CNAs, male nurses. Well, they just don't feel comfortable. We'll tell them to get over it. Like we will 100% ask that person, hey, look, would you rather have X, Y, or Z? Because they would rather have. But there's also a big difference between going and seeking out one thing and being like them having a patient and them saying, hey, look, mama is kind of old school. They are, maybe they're Muslim, maybe they're, fundamental Christian. The only person that's seen her naked is, other females or her husband. Like that's one thing. But to go and seek that out, that's a big difference. And one of my biggest frustrations is that when I was in a meeting with management at one point and I brought this up, they're like, oh no. If they say that they don't want X, Y, and Z, then they get that. And I'm like, I'm just telling you that you could be sued over this stuff and you'll lose. Like,
We do not play with discrimination of such sorts here, friends. We do not play. James Connolly, thanks for becoming a friend of the channel. I appreciate you. And for the super sticker. Thanks, friend. Welcome to the Rambles. Good luck. Go for it, Scott.
No, I don't want to get off on that tangent. I was just thinking, how can they get sued if it's the patient? Unless somebody at the facility is actually doing like what Chad was talking about, where they're going, you don't want a male nurse, do you? That kind of thing. If the patients ask out of their own volition.
No,
then, so you're saying, so if the patient asks and then the facility says, okay, then we will only assign you female nurses, that they can be sued because they're not assigning you, they're not treating you.
Now, this is a whole other legal argument that you're going to have to talk to lawyers about, but I think you can make exceptions. For example, if you have a R trauma nurse or some sort of SA trauma nurse where there has been a or someone with a history of male propagated SA, because that can fall under undue burden. But as a general rule, just because the patient doesn't want a black nurse or a male nurse or an Indian nurse or a Muslim nurse or whatnot, that is not a reason that they get to say, hey, look, well, you get who you get. If that person is informed of that and makes the decision to switch off, that's entirely different. That's optional on the nurse. But the facility doesn't want to or doesn't do that. I would cite to a case in Michigan related to labor and delivery, actually, where there were white people who were racist and did not want non-white nurses.
So if it's a legitimate thing, like a cultural thing or because of a past trauma, that's one thing. But if it's just because of personal preference or prejudice or something like that, then that's not legitimate. I think I
And it's
understand.
and it's usually pretty like, I mean, in my experience, even in peds, it made sense. Sometimes we would have like, if we had a young male on the floor and he was like, in puberty, whatever, and we were going to be having to, like, if you're straight cathing and doing all that sort of stuff, and we had sometimes we would give them options. We'd be like, hey, we have some dude nurses, we have some girl nurses. What do you feel more comfortable with? And same with like, the prepubescent, the girls who are just so young and like, you're just so unsure of everything with your body. And they're just like, oh my gosh, like I'm going to be putting leads on you all day. And they're just like, I don't want him to see any, like, so like things like that, where you're like, obviously you're 13, like you're just not quite there. You know what I mean? Emotionally yet. I don't know if that would come off as offensive. Obviously I've had young dudes be like, no, like, cause we had enough young guys on the unit that we could usually kind of switch everybody around. So it didn't offend me, but I'm not the minority in the situation, not being a dude.
And for me, if the patient doesn't want me, they'll make that known. I have
That's
no
probably
problem
true.
with that.
Mhm.
I have no problem with that. It's when the other nurse goes in and greases the wheels and sets me up for failure before I've even walked in the room.
Mhm.
Yeah, because I remember this from nursing school, which was a long time ago. But you go in, and I had an OB rotation in Southeast Missouri in the late '80s, or like 1990, and I didn't have any trouble with it. I mean, they were like, yeah, come on in. You want to watch the birth? You want to give some fundal pressure while we're delivering? I loved like feeding the babies in the postpartum nursery. That was fun. And then the with the moms, I mean, it was just one of those. I walked into one room, like the very first time, like with my instructor or something, and the woman's like pulls her sheet down and is like, oh, I thought you wanted to look. Everybody else has been looking. It's like, well, we'll get to that.
The Mormon Tabernacle Choir's been in here. Why not you?
Yeah.
She's like, everybody comes in just wants to take a look. So I'm like, well, we'll get to that. But, even if it's like, you could see they're not really sure about having a male nursing student, it's an opportunity to prove yourself and say, it doesn't have to be awkward. In concept, no, I don't want a guy. But then when it's me or whoever it is, it's like, well, I'm comfortable with you. You're kind of cool. We're joking around. You're not making me feel like you're creepy or anything like that. So it's really a disservice for another. That's an awful kind of bullying, to be undermined by someone on your floor like that. I've never heard that thing, and
I'm excited for
I'm upset about it.
The stream where we talk about this. I feel like we have big feelings we need to get out.
Well, even with students and stuff, it's all on how I, as a nurse, go in and introduce them.
Mm-hmm.
This is John. He's going to be with you today, or we're working together today. Versus, this is John. He's a male nursing student.
Is it okay?
Yeah. No.
I hope you don't mind.
This is John. We're working together today. Period.
Yeah.
If she really has big feelings, she'll say, "I'd rather not."
And if you're I was like, if any of you are like either people placing people in learning opportunities where you do need to do like gynecologic exams. We're not like exactly talking about this today, but if you can find someone who has already had a baby, key person there, after one, we don't care. Okay. Like it can be anyone. We're like, yes, welcome. Like, would you like to get me out of this office quicker? Come see, let's go. Like, so just find someone who has already had a baby or who currently has an epidural for placing Foleys. Okay. Your care. Like, I'm telling you, as someone who has been in labor after getting a Foley, you were like, you can do it. Or after getting an epidural, you're like, that's fine.
There's a little off topic, but it is an opportunity to teach patients and maybe it combats some of the racism, sexism, homophobia, whatever it is. You get to prove to them who you really are, even though they're like, I'm not sure I want you doing this. And then that's your opportunity to say, well, give me a shot, see how it works out. And if you're like, no, I still don't like it, it's like, well, then we'll deal with that. But and the one way to do is what Chad said. Don't even give me an option. It's just like you get who you get.
Yep. And, Yep. Also, Nurse Adrian has joined us. Do you want to introduce yourself really quick? And then we have a good question from James.
Hey guys. Hi, it's Nurse Adrian RN. I'm a board certified patient advocate. I'm here on YouTube and also on TikTok. Thanks so much, Nurse Liz and everybody. Happy to join. Sorry I'm late.
Oh, we will definitely hold it against you forever. How dare you be in class? Very rude that I'm holding these chats in the middle of the daytime when It's most inconvenient for literally everyone except for me. So
we so needed you in the last one, Adrian. I hope your nose was your ears were burning. We were talking about you.
I'm
talking about unions and striking and what we can do to organize a union at a hospital that doesn't have one. We're like, my God, where is Nurse Adrian when we need her?
I'm going to come up with a day when more than 3 hours in advance, I'm like, I'm going to do this and give you a heads up. And she's going to educate all of us. It's going to be miraculous. And that was our, if you missed that, that was the one we did on Monday where I tried Tuesday, where I tried to talk about unions and kind of did.
You did a great job. You did a great job. It was well done. And thanks for the, plugs. And yeah, it's, unions are complicated and it's a lot to unpack. So it really does take quite a bit of time. I have multiple series of 3-minute videos and it's a lot.
Go to her TikTok. It's the best. Okay, so basically what we're doing, Adrian, is we're going around, we're simultaneously answering questions and playing games where we share our own experiences and we ask the chat if we were bullies or not, or if a situation is bullying or not. So basically we're roasting ourselves as well as answering questions and roasting anyone else who comes along and deserves it. James Connolly says, how should a new grad Murse handle a mean older female nurse? Being direct just makes me come off as a jerk in this scenario. Do you have tips, gentlemen?
I'm going to take this
panel?
one.
Perfect.
9 times out of 10, a lot of times what those nurses are feeling is one of a few things. One, this is our house. We are in, you are a invitee here. You need to learn the ropes. You need to do X, Y, and Z. You need to prove that you are not incompetent. And because most of the time as nurses, what we care about, what we will go to bat for are when, Joe Schmo over there is giving a shot of IM Rocephin in the abdomen where it doesn't belong in any stretch, right? Like when they are making some big boneheaded mistake, like trying to give SBS or KXLate through an IV. Right, like once you get to the point that we can trust you, that we can say, hey, look, I've got this patient, this is going on. Do you think, what do you think is going on? Because this is what I think, but I want to get another opinion. Like all the other nurse wants to know is that you are not an idiot, okay? Because if you are not an idiot, and we're going to be back-to-back in codes or back-to-back in, I don't know, trying to clean people up or whatever else, and that you've got us, we're good. So in my experience, a lot of the older female nurses just want to know, hey, look, you aren't somebody who's going to be like, hey, look, from the waist down, I don't do anything. Okay? Because that's a no-go. Then we are going to find you a new job. Just work it. And when you screw up, accept that you screwed up, prove that you're going to learn from it. I mean, that's my take on it.
I think there's a difference between when you say a mean nurse, if they're correcting you and you feel like they're correcting or they're teaching, like telling you how to do something when you already know how to do it. And you're like, no, we covered that in nursing school, how to do a blood pressure or something. Just say, thank you so much for showing me. Thank you. If they're calling you names and actually being mean to you, then that's a no-go. And you don't want to come off as a jerk, but you can go up to and say, hey, Janice, I would never talk to you like that.
I like that.
Let me call you out. That I understand I'm new here, but I would never do that to you. And sometimes you don't know, and someone did that to me once. I was talking about someone behind their back as a new nurse, and she said, so what's going on? And I'm like, you know what? I really like working with you. I really don't know why I was doing that. Thanks for calling me out. I was just going along with other people who were saying bad things. And that's not fair to you. And we ended up being like this the rest of my time there. If it's bullying, you got to call it out and do it in a way that's, but if you think they're being mean because they're correcting you or they're telling you how to do something you already know how to do, just thank you. Thanks for showing me that, Janice. I appreciate it. Yeah, it's the third time you've taught me how to, do this.
So let's give a concrete example so we can give people a way to actually respond. So I like the name Janice. It does sound like you could be very snooty if you were a Janice. So say I, Janice, came to you and we have like Edward. Okay. Edward is our ambitious young nurse who happens to be male, not a male nurse, a nurse who happens to be male. And I, Janice, say, I can't believe that you didn't get the labs at 5. We always draw labs at 5. Why are you so incompetent? Response. Because this is what I dealt with a lot. When you were handing someone over and they were like, don't you know we get labs here? Or don't you know we do this here? How would you respond in a way that doesn't come off as, what did you say you were worried about coming off as? New grad or grad being direct makes me come off as a jerk in this scenario. Because I don't think it's always bad to come off as a jerk. You won't come off as a jerk by being direct. If you just come off and say like that, like, hey, I don't appreciate you talking to me like that. Like, I didn't know that this is how I would come off and say it. If Janice came off and said that to me, I'd be like, hey, I didn't know that we had to get labs at 5. Now I do. Thanks for telling me, but I really don't appreciate the way you told me because that wasn't super helpful. And just that. And that usually doesn't come off as being a super duper jerk. That's a mild Liz reaction. We go up from there. But at her most pleasant, that's how Liz would respond. And then you can kind of escalate. But just saying, please don't talk to me like that. But now I know going forward. So making it like, okay, I recognize that you are trying to tell me something and going forward. And that can apply to most situations, I think, that involve bullying. You could do that with assignments. Hey, I don't know if you noticed, but all of my patients are total care and I have no tech and they are all like 2 of them are on constant drips. Like this is unmanageable for me. We're going to need to let's switch things. Can we switch things up? And just so things are a little bit more balanced, I won't be able to do it this way. Very direct, not coming off as like entitled. I can't do this. I won't do this, of just like, here, if you just present facts and try to keep as many feelings out of it and they get insulted by it, I mean, that's a them problem. But I think you can just be really direct. And if they interpret that as you being a jerk, then I don't know what to tell them.
It's on them after you say what you want to say. I was a traveler at a nurse. The way they did it was the doctor wrote orders and put it in a basket on the counter. And when you see the clipboard in there, you pick it up and you go and you take off the orders, you start the IV, draw the blood, whatever. And I'm kind of a laid back kind of guy. I'm not really, antsy and jumpy. So they put that in there and I would take another swig of my drink or whatever and then get up and do it. Well, there was another nurse who actually did introduce herself as, hi, I'm the old battle axe you'll be working with today, when I first met her. So that should have given me some clue. But then she would snatch those out of there before, he'd put it in there and she'd snatch it out of there. But then she would complain that I'm not doing my work. And I said, Janice, whatever her name was, I said, you can't snatch those out of there before I can get to them and complain that I'm not doing my work. You can do one or the other. But you can't do both. And for her, didn't change things. So my 13 weeks was up and I got out of there.
Goodbye.
I think there's a component too of, as a new grad, and there's new grad versus new nurse. So those are distinctions, right? So I would say, I was 39 coming in as a new grad, right? So that's challenging in itself. And I really just did a lot of sucking it up, honestly. There was nurses who, even though they liked me, they would still give me a hard time at shift change, at report time, no matter what. It would always be something. And I think one thing that's so important as a new grad is, or anybody, is don't talk to each other about somebody else. Go to the source, handle the problem, because then when you start talking to anybody else about it and gossiping, then you cut off the opportunity to actually create a solution with that individual, because now you've created all this energy around the issue, and now other people are carrying the story or the issue or the bias, right? I think, I always tell new grads, like, or people coming in, like, bring food and snacks. That usually is the winner. I mean, like, I worked in Southern California, so I'd be like, stop by the Filipino bakery, load up, drop $50. You're going to be golden. It's like worth the investment. Just do it.
Yeah.
And, and I literally have had so many nurses thank me and say, wow, like that really worked, But, I actually had a bullying accusation from a new nurse, a new grad, that it ended up being very interesting how it turned out. And it was about, hey, you didn't administer the stat blood. And then they lied and said, oh, I didn't have anybody to witness like the entire shift, right, of a staff of 10 on our floor. And I got the break nurse and I said, hey, did he ask you? And she said, no, not at all. Okay, so now what are you going to say? And then he turned around and went to HR, accused me of bullying him. And then they tried to write me up of the 100th time at my hospital. And eventually he left, he quit, but, he just created a big scene about it that became very divisive in the unit, and very created like some cliquishness within the unit of like the younger nurses and new grads and his buddies. And then those of us who'd been there for about 10, 12 years, who were then now the senior nurses, more or less. And it just created an unpleasant work environment, all because he wanted to deflect about not giving blood. And he was, management, like the management loves the new grads. They love the young kids, they love, because they like to pat you on the back, but they leave. And we had, like a 75% turnover of the new grads in the last 5 years I worked as a nurse.
Yeah. And that goes back to like how people are going to interpret it. Like some people really don't like being corrected at all or called out on their BS. And not all nurses are great, friends. There are nurses who are going to try to say, oh, I didn't do this. So let me just, rather than coming out and saying like, I didn't do it, like they will try to come up with a whole convoluted system of why they didn't do it. And then they don't like being called out because that doesn't feel good. Carol Santos gave us a situation. So I personally believe that passive-aggressive bullies are the worst, but how do you address a passive-aggressive bully who hasn't stated that they hate you, but are out to ruin you? This is personally the brand of nurse bullying that I seem to find the absolute most. And it's hard because you can't pin it down. You know what I mean? And then you go to describe it to your friends and you're like, Janice she never refills the gloves. Like when she knows, like, you know what I mean? Like she'll take the last one and she doesn't refill it. And people are like, wow, you're petty. Or she won't go in and like hang a flush on my patients. She won't go in and do that. Like, so just like little tiny things that build up and make it feel like Janice is like trying to actually make you quit your job. Saying little things, not being helpful, throwing you under the bus here, making little comments. How do we handle a Janice who is a passive aggressive bully, but it kind of sounds insane when you say the things out loud, so you can't be like, Janice, dang it.
Let the haters hate, right? Like one of the things that I found is that if you are just better, people are going to dislike you for being better. If you are going to, like take all the bad things that you've done, recognize, hey, look, I could have done X, Y, and Z, and then change. Do stuff better. You know what? You forgot to do this assessment when you did X, Y, and Z. Do it better. Hey, look, you forgot to restock the cart after an exceptionally crappy shift, and your water is empty. You don't have all the diabetic testing supplies. You don't have cups. You don't have medicine cups. Restock it. Like, go the extra mile. Don't give them an inch to talk about you. Because the bottom line is that, like, when you don't give them an inch and they're still harping on you, that's a them problem, not a me problem.
Yep. And I have a shocking way of dealing with this that's a lot nicer than probably people assume. But first, Melody has to go and run in just a second, but I wanted everybody to have the chance to say bye. And if you have any final thoughts, Melody, that you would like to share before you have to run, we are all ears. Oh, I muted her. Hang on. That was a me problem. Okay, you're on now.
Basically, someone brought this up earlier, but I do think it is very important to watch your tone and your body language, just in terms of all types of communication, and that it is definitely best to do things in person and either in private or with an agreed upon mediator for just the most accurate processing of what's going on. Texting and all that, where you can't hear tone of voice and see expression and facial, it's just, as an overall rule, but particularly in any type of conflict, including the medical field, I just think the more one-to-one human contact, the better.
Agreed. Excellent wise words. Thanks for being here.
Thank you for having me. See you later.
Bye.
Bye.
I think it's really, one thing I would say to anybody who's having any interpersonal issues in their job, in healthcare, whether it's lateral, it's with a manager, is to remember to frame things in as much as you can about patient care. That what they are doing is disrupting patient care. Keep a diary of things, put it in your phone, the dates, the times, right? But I can honestly say it's not a winning strategy to say I feel, right? It's a winning strategy to say this is impacting patient care and impeding and interfering with my ability to give the best care that I want to give. And I want to clear this up. If you have to escalate it, if you have to go up the chain of command. And sometimes, I've had managers out to ruin me. I had a friend of mine is dealing with a situation. It's very interesting. She actually caught 2 other people in this very small department of 4 going through her locker and in her bag.
Ooh.
And like overtly they're out to get her. And, and it's been a very frustrating, challenging situation for her. There are some times where you do have to just choose to leave that environment. You may not be able to win, and you have to frame what winning is, right? And also understand that healthcare is extremely toxic. Nobody's trained in interpersonal communication. It's a trickle down effect. And that's something you have to assess when you go into any job, but especially in healthcare. And I will say, as a new grad, one of the ways I work telemetry and step down, I would always volunteer to stay overtime, and I would ask, hey, can you float me to the ER so I can do task? That was a very winning strategy I had. and it was always very well received. And, let me go help another department. I don't even want to stay in my own unit, but I'll go to ICU or I'll go to ER to task and help alleviate their load. And I would go down and I would do all the admissions in the ER for the patients so that those were done for the floors when they brought the patients up. Right? Think out of the box about how you're creating value and keep that documented.
I like that. So it's much more diplomatic, and I think that's helpful for when it's not just words. You know what I mean? Like when someone is actually going through your stuff. How I handled it when it was just words, because I'm petty, is if people were really mean to me and it was in a very passive aggressive way, I would be so nice to them. I would go out of my way to help them. I would go out of my way to be obnoxiously helpful. And usually, not always, and this was not when no one was going through my stuff. No one was physically harassing me. I felt very safe. I was just trying to be obnoxious. If you're so nice to people, usually it shames someone else into saying something like, Jesus, Janice, you are so mean to her and she's always helping you. Most of the time, this actually worked for me. Someone else eventually called them because they would talk crap about me to someone else. And they were like, she's usually pretty helpful to you, actually. What are you talking about? Or they eventually gave in and realized, wow, this person actually is kind of nice. And they got nice to me, or they didn't. And I just got over it and ignored them and pretended that they literally did not exist. So one of those 3, but usually if they're not being too physically mean to you, you could sort of get through it. That was how I did it. Obviously that doesn't work for every situation, but it did help me with a lot of really cranky people. And then other people were really confused. They were like, Liz, I can be pretty cranky. I'm a little sea urchin, a little pokey. And then they were like, and she likes you? I was like, I know. I know. I did it. I'm glad you like that plan. Kill them with kindness. So that's how I go about it. And that's the benefit of having a panel, is we all go about it in such different ways. Yes. Second Opinion says there's one thing we can take away from the stream. It's Liz is definitely the least diplomatic on the panel. And that's absolutely true. That's why I hid on nights and weekends. And
It depends. It depends.
No.
I've had my moments.
No.
There was
No.
another travel assignment, and I had
Cal.
the secretary say, she would say, "Oh, you have a phone call. You have a phone call." And she goes, "Why are you not picking up your phone call?" And I'm like, "I just got back from lunch." "Well, you need to pick up your phone call." And I said, "I need to pick up my phone calls while I'm on lunch. I just got back." She goes, "Well, it's on line 3." I said, "You know what? I've been here for 2 weeks. You have not said a kind word to me the entire time I've been here." And she just was like, "Well, you have phone call on line 3."
Yeah.
And in this case, it was the secretary, and I'm not like big on yelling at secretaries, but I had to call her out and say, "You know what? She had been really kind of crass to me that whole time. I'm here to help you. Yeah, I'm getting paid. Little common courtesy is all I expect, really,
Yeah.
But sometimes you do have to be not diplomatic about it.
Oh,
and
yeah.
just look, this
And
is
you can-
BS.
And I have said that to people. If they're coming at you and they're just being really grumpy, you can just be like, "What's going on?" And I usually, like, in my language, I'm like, "Friend, what's happening?" Like, there's a lot of like in peds, we called them a lot of big feelings. So you're like, "There's big feelings. Like, what is happening?" And usually that'll get people out, and they'll be like, "You're right. I'm on steroids. I am losing my mind," or whatever
Yeah,
it
like
was.
the nurse that came to me and she said, "I don't appreciate you talking about me behind my back." And I'm like, "You know what? Thank you for calling me out on that. I don't know why I did that, or I was having a bad day that day, or it can
And
be
not joining in, which is I think we've all, I've definitely talked about people behind their back. I did get a lot better at it the longer I had been there, because I realized that's just not the vibe that we were going for. But you can always just opt out. When people are talking, just leave. Like, you know what I mean? Like, just walk away. Because at first I was like, I don't know how. When I first realized, I was like, I really don't. I'd like to see a different shift. I shouldn't be a part of this. One, just stop talking about other people unless it's in a positive way. And then two, just don't say anything. There's a million things you can do when you're at work. So you can just pretend something came up and just like wander away. And eventually people will realize you are not engaging in that. And they'll stop. Like, that will help stop the whole bullying, nurses eating their young, like, cattiness aspect of it. Somebody earlier had asked about like when there's cliques, and that will eventually wear them down. Like, eventually. Some people are still just going to be the worst, and you just ignore them. You let them be miserable.
And some of this may be going off on a tangent again, but there are different work styles, and it can be individual, but I think there's also some gender specific nurse styles. It seems like men go in, they do their job, and if we make friends with the people that we're working with, cool. You want to go for a beer afterwards? That's great. I'm not the butchest guy in the world, but I'm just, acting right now.
But play some football?
Yeah, you want to come over and watch the game? No, you get to know the people. You go, you do your work. Hey, you didn't do this right. Oh, sorry, I'll do it. It's not personal. Oh, hey, I need help doing this. Hey, no problem, buddy. And if you get along with the people you get along with, that's great. Whereas it seems like from the outside, from a male's point of view anyway, that the women come to work and it's a sorority and they all need to get together and be best friends and buddies and let me see pictures of your kids and all this. And then together as this group, we can go work and get the work done. And so when you have men and women that are in that headspace working together, you're going to have problems because the guys don't want to see pictures of your kids and the women want to bond with you before they can do, this work with you. So maybe it's gender specific, maybe I'm overgeneralizing, but at least it's true that people individually have different work styles and we need to respect those and recognize that when we have different styles, that's when things can go, that's where the friction can start that can seem like bullying, or maybe it really is bullying.
And you're absolutely right, Scott. Men and women, especially in labor and delivery, it's very, very obvious, function differently. Anytime I'd start a new job on a new unit, there's always a trial period, and I don't care to see your kids' pictures. I don't care if they won the basketball game on Saturday. I don't care. But when the brown stuff hit the fan, I was in your room. I was on top of it. I was throwing an extra IV in. I was pushing the bed to the OR. I was with you. I never left your side. And it eventually would always come down to when the brown stuff hit the fan, they'd say, "Go find Chad. Get him in here now." And I wasn't the hero. I wasn't saving the day. I would just do my part, but I was always there, and people knew that. So, very task-oriented, but nobody died.
And if you
that may
keep
cross
showing up,
those lines. That may
Yeah.
cross gender lines. If you're there to help and you've got someone else's back, I think that works on either side of that fence.
And that's my best tip I tell people. Yeah, just keep showing up and offering help. Just be helpful. Try to give, like, don't burn yourself out or whatever, but just like be helpful when you're there. Be willing to be like a resource. And eventually people will come to you and see you as that and not like, it's really hard to paint people as incompetent, lazy people if they're always the one who's like, I am here. Like, I'm reliable and I got you.
The one thing that I really want to caution people about, gossip is not always a bad thing. There's a lot that you can learn about how people work based on what they tell you, what they tell other people, what they tell, like, whatever else. And if you participate in this is the thing that I find important in my life, right? Because I'm thinking of the nurse that actually I worked with for about 5 years. I used to call her my work wife, still do in a lot of regards. She had 3 sons. We would talk about them. We would talk about the problems she was having, whatnot. If you interact with them on a meaningful level that's important to them, it's very hard for them to be like, well, Cal over here is being a jerk face, or this, because they see you as a person, right? Well, I think Chad and me would get along really well because, like, we're both, okay, here's the job we need to do. Here are the things we need to do. We're going to get out. We're going to leave. And then we're done, right? Like, we're 7 to 7. We're going to, do everything we can as early as we can, because then if ish hits the fan, we can plan for it, right? Whereas other people don't work that way, right? Like, you have to understand and read the field. And at the same time, one of the things that's most important to me, I work through an agency. So there are some weeks that on 7 different days, I've worked 7 different facilities. And, in a lot of these facilities, I'm not familiar with the nurses. I'm not familiar with the CNAs. I'm not familiar with the X, Y, and Z. So when I go in, I'm going to talk with a nurse. I'm going to talk with a CNA. And a lot of the people at the other facilities that I work with will give me information that I need to know, right? Like, hey, look, this other nurse that you're working with, when they worked night shift 3 months ago at facility X, Y, and Z, they were found naked on the bathroom floor, high as a kite, which, like this might sound funny. This is an exact thing that has happened within the past 3 months for me. Okay. Like, there are things that you need to know. Hey, look, don't give this person your keys. Don't give them X, Y, and Z. You need to be really careful around X, Y, and Z for this, that, and the other reason. And take everything that other people say with a grain of salt. But, like, anything that people can give you is something that you need to evaluate. Like, is this worth looking at? Is this worth, adding to? And hey, look, maybe I don't want to go out for 30 minutes to go grab some food from McDonald's or the other place that's open at 3:00 in the morning, because, I don't know if X, Y, and Z is going to be high as a kite in the bathroom floor. And when my patient codes, it's on me.
That would be good to know. So that's fair. Chat, gossip. Good, bad, sometimes good. We're putting it to a poll. I have found it to be more catty than mean, personally. Scott, your vote?
I have always heard gossip is social currency. So you exchange it and it's exchanged with you, but it doesn't have to be negative. It can be, hey, did you hear so-and-so's kid won the spelling bee or something. Or it can be good things. It's like, you should have seen this patient we had last week. Yeah, it was rough, wasn't it? Yeah, and that those kind of things doesn't have to be catty, but
True.
it is a form of social currency. It's part of the binds, it's part of the ties that bind.
That's very true. Adrian, gossip, good, bad.
Well, the
Sometimes.
chisme, the chisme is okay. I think it's my role as a union steward. I had to always be really careful. It was almost like HIPAA with workers. So I had to be very careful and conscientious about what I spoke about. But you do have to be meaningful and intentional. And it's different than being relational. The relational part is fine. But trust me, if you engage in gossipy, like low-level talk, you will eventually end up in HR as a witness against another worker. I can guarantee you that. If you're a full-time staff employee, you will end up in HR as a witness against another coworker, or you will end up saying something that implicates somebody in something else that gets somebody in trouble, or you get in trouble. So you have to be very careful. I wouldn't say, all communication is not gossip. I would say have meaningful, intentional conversation. And I was kind of a down to the business, kind of person as a nurse, because I always had a lot of people coming at me with questions, other coworkers all the time. So for that reason, I had to have all my work done, because I knew I was going to have 20 other workers in the hospital call me or email me, text me, come find me about some work-related issue.
Yep.
And I'm with Cal. There's a difference between gossip and information sharing. There's a difference saying, hey, she's just a snot rag, and saying, man, if you need an IV, he's your man. If you need somebody to de-escalate a situation, go find her. That's information sharing. That's not gossip, and that's okay. That's good. That's needed.
Gossip, in between. It's been voted. Excellent.
And so much of how people act at work, it seems like, is based on how they're feeling about themselves. Because I was just thinking about that. Like, one of the things I can think about gossiping is like, it's like, oh, you know what? I went in after, what was his name? I shouldn't use his real name. Went in after Greg, and he had spiked an IV bag. And how sometimes you'll spike it and the tip will come out the side of the little nipple, the little spout. Well, he put some tape around that and hung it. And I'm like, oh, no.
A for effort.
Yeah.
Good try.
he was a new nurse. I mean, because it was dripping. So he wanted to, stop the dripping. But I'm like, bacteria can get in there, just for the lay people watching. Bacteria can get into your IV. No bueno. And so I immediately changed it. And I went to him and I did correct in private. And I said, by the way, you can't do that, man. and here's why. But it's something I could see myself like gossiping about later, and like saying, it's like, oh, I said the funniest thing happened. I went in after Greg and he spiked the thing and he didn't even know. He put tape on it. Are you kidding me?
Yeah.
But maybe I'm doing that to make myself feel better. Maybe it's funny, and maybe I would have told it with him present, which is a good rule. Would I say this in front of that person? But it might be I'm like, yeah, he screws up all the time. Maybe it's because I'm feeling like I'm not appreciated, like I needed to boost myself up. And that so much comes from management, and it comes from each other. When we feel appreciated, when we feel supported, we're less likely to turn on each other, because sometimes it's a displaced kind of anger. We're mad at our bosses and the whole situation, and there's no person to scream at. So we pick whoever's, or we abuse the CNAs or someone like that who,
and someone had asked, why do you think nurses eat their young so much? And I think it's exactly that. I think there's so much frustration and there's so much tension that it just bleeds over into, like, it's like when you're like in your relationships, you're the meanest to the people who are the closest to you, because they're the ones that are like right there. Nurses get the brunt of it all the time. It's not that we did anything. It's that all of a sudden the provider's like, oh, you're NPO now for like 12 years. And they're really mean to us. It's because we're the messenger. You know what I mean? So tensions are high. And then it's kind of a rough place right now.
It just speaks another reason why we need support from management. We need adequate staffing so that we don't feel like we're running around crazy and doubting our skills, because it seems like I'm not doing what I'm supposed to do. There's something wrong with me, when actually I'm just being asked to do too much.
Yep.
So when you take care of the nurses, make sure that they're supported, they feel good about themselves, they're less likely to turn on each other, less likely to feel like they need to prop themselves up by talking bad about other people. You can see how this all kind of trickles down.
I think it's important to know the difference. Oh, I'm sorry, Cal.
No,
quick,
go ahead.
I think it's really important, though, in this day and age, to understand what lateral violence is, to understand bullying. I know that things I did even as a new grad that I participated in could have been perceived as hazing. I'm just going to say, there may or may not have been things that happen in body bags.
We've all admitted that we've been
Right.
we've bullied people.
So
when at some point, so you're not alone.
I mean, it is a fine line, right? Because we work in this crazy stressful environment and we want to have fun and we want to joke around and release that tension. And often it's very, it can be construed or perceived as being inappropriate. It could actually be inappropriate. And it's hard because we don't have those mechanisms. Mm-hmm. Nobody in nursing school is taught, hey, here's how to handle stress, mm-hmm. right? There's no batting cage outside the back of the ER, mm-hmm. right?
You're trauma bonding.
Right, exactly. Mm-hmm. And so, but it is important in this day and age that we do understand this higher level of lateral violence and language and our own bias. And if we're self-aware, just be a team player and always know you may be coming into a situation where maybe I got a $15,000 sign-on bonus and I'm getting paid $50 an hour and you've worked here 10 years and are making $45 an hour. So understand as a new grad or a new nurse or staff, you don't know the situation of other people, and mm-hmm. why they may be having some resentment focused on you, but it's really because they don't have a mechanism to drive it to the organization. That's all.
Yeah.
And, as a provider, I go back to what Scott said a minute ago. You realize that it does roll downhill. It's always the guy at the bottom of the barrel that gets the worst. And so I've made it a point, never criticize my staff, never criticize my nurses. If I got anything to say, it's positive. I make it a point to not criticize.
Mm-hmm. Rosalind says it's refreshing.
I was a brand new nurse. I worked with a doctor who's Orthodox Jew, yarmulke, tallis, the whole thing. He looked at me and he said, SRDH, shit rolls downhill. And without blinking, he goes, it's in Leviticus.
That's amazing. I love it.
I have a question, though, because this is having dealt with what I would consider a new nurse. We had a nurse that was training at a facility, had been a nurse for 5 years, had never done anything bedside. This nurse was slated for a month of one-on-one training, which, if you know anything about long-term, this is unheard of. If you get 2 weeks, you're like, ah. After 4 shifts, this person had been like, no, I'm good. I don't need anybody. I can do everything all by myself. I'm a big girl now.
Good luck.
Right. This is how a lot of the nurses treated this person, because this is where I'm drawing the giving a shot of Rocephin in the abdomen. This is where I'm drawing. There was a code, and CNAs were the only people involved in the code.
Ooh.
Right.
Very helpful, but for people watching, CNAs are you can be involved in it, but usually there's someone else running it.
Right.
Pushing meds, doing the things.
Well, and again, codes and skilled are entirely different.
Very different.
Because for the most part, a code in skilled doesn't have IO access. We don't need to be ACLH or ACLS certified.
That's a very good point.
But while I think that needs to change, that's an entirely different area. There are specific things that I expect a nurse to be in there for, because this is your patient.
When you escalate, there's really not much more of an escalation. than a code.
Right. And this is a person who, hadn't been taught, hey, look, anytime that you're giving IV medications, you need to make sure that you clean the hub. You need to, this is how you problem solve this sort of thing. If you have a wound vac, here are the steps for going A, B, C, D. If you're going to give somebody nitrostat, then with that first dose, you also need to be giving Mylanta or Malox or whatever your thing is because, this could just be indigestion. And, it's one of those things that when nurses talk about other nurses, sometimes I think that you can call it gossip, but at the same time, I also consider this, hey, look, this nurse is weak in these areas that you need to consider. And if you're working with them, you need to be looking out for X, Y, and Z. And to give an example specifically, I had a nurse that I got a report from. She's an RN. She's working in an ER now. Says that the patient has been vomiting since like 11 o'clock, and I'm coming in at 7. Okay. Zofran didn't help. Phenergan didn't help. Is like, oh no, everything looks normal. It's just what she's eaten. And I'm like, When I visit her, she has like Coca-Cola icy on her stomach because she's thrown up again. She looks like me where she has a 9-month pregnant look. And anybody with any sense is like, hey, look, this is a GI bleed. This person needs to go to the ER. And to me, a lot of this information is just it's not gossip as much as it is, look, if you're getting a report from this person, if you're following this person, if you're working with this person, you need to subtly be like, hey, have you considered this? Have you looked at this? Because what 9 times out of 10, in my experience, nurses get really up in arms about is when the patients are put at risk. And if you hurt my feelings, I'm going to be a little mad. But if you put my patient at risk, we going to have some words.
And then it becomes the safety thing, which then goes back to how are you interpreting that correction? You know what I mean? And it's going to be people who are like, oh my gosh, you hurt my feelings. Teresa wants to know, how was this nurse's competency ever checked? Agreed.
Well, what you're describing, Cal, is if all you have is CNAs and a code, that becomes an HR issue, and we either need to retrain or find you a new job because this isn't going to happen anymore.
Yeah. And it goes back to naturally nursing is saying this is a new culture of harshly punishing Medicare providers being honest, reporting errors has not helped things. So people are so scared of getting sued or getting in trouble that you're much more likely to bully people, not in defense of the bullies, but you know what I mean? It doesn't create an environment where you can just be like, hey, you made a mistake. Here's what you do differently because you're scared and you're panicked and you're like, oh my God, how is that going to come back on me? This is not going to look good. So I wanted to end with running through a few scenarios and giving people language that they can use to deflect the bullies. Because I think sometimes having concrete examples is helpful. So we'll start with a fun one that you should all implement. Please do. When someone says, because we talked earlier about bullying, sometimes other nurses will either be like, are you even old enough to be a nurse? Or you're way too old to be a nurse. Or patients, usually patients are something about that. But if a nurse ever says, are you even old enough to be a nurse? The response is, oh, I'm not a nurse. And then you just keep going. Same as when patients say, are you old enough to work here? You say, oh, I don't work here. And you just keep going. Okay. That is the appropriate response. And if Scott has a different one, he can try to submit it, but it's wrong.
Are you old enough to fly this plane? Oh, I'm not the pilot.
Oh yeah, exactly. Exactly. You do not look old enough to be a nurse. Oh, I am not a nurse. Just any other responses?
Are
When we
you
get
waiting
told
for
we're
an
too old or young?
alternative?
Oh yes. I mean, I am willing to accept that like
I
you
mean,
might
it's
have a
not,
worse option to say, but it will be worse.
it's not funny, but you just say yes. Are you old enough to be a
Yes.
nurse? Yes.
Yes.
And if you
Yes.
feel like saying, yeah, I'm 24 or I'm
Or
25
just yes.
or just yes. Yeah.
Yeah.
And if they
Just
want to
yes.
talk more about that, that's fine. It may just be one of those things they think they're being funny. You know,
I think if it's from a patient, I think it's important to acknowledge them and say,
Yes.
you know,
From a
hey,
patient.
I know it must seem crazy, right? I look really young and I am young and I'm here to give you the best care possible. And I went to a great school, you know, whatever you might say.
Mhm.
But it is important to instill confidence, right?
Mhm.
You know, our
Or
patients.
you could give Yoda's response: when 900 years old you are, look this good you will not.
Yes.
or
Old
I was
enough.
I was a
am.
child prodigy. I was a child prodigy.
I'm
I
actually
mean-
310 next week.
Yeah.
Like,
Oh.
my response is, well, I just hit puberty last week. Is that okay?
Great. Great. Love it.
Like,
Is that okay? Perfect. So there's some responses across the board. Next, when you're giving report, because again, that's when I ran into this a lot, and someone keeps interrupting you, which can be pretty obnoxious. And they just, you know, those people you're giving a report and they like come at you about everything. You're like, so this is per so and so, and she's in for how long has she been here? And you're like, okay, just calm down, Janice, and allow me to finish. And you're like talking about like her pain regimen, and you're like, yes, and she gets pain medicine. And she was like, when was the last time she pooped? And you're like, oh my gosh, like just let me. How to intervene with that, because it took me a little while to figure out to say it. So all you have to do in that situation, from my opinion, and then we're going to hear from everyone, is, hey, I know you have a lot of questions. Can you just let me get through my whole report? And at the end, if you still have questions, then feel free to ask them and move forward. But you do have to say something, otherwise they will keep asking questions and you might yell. And that's not good.
I think in that I would just, when they burst in with, when was, I just gave her pain medications. When was her last bowel movement? Just wait.
Mm-hmm.
I'm getting to that. And hopefully they'll get the hint. But yeah, I like that.
Do you want report or not?
Yeah.
You want to?
I like that.
You gonna let me get out of here?
Shut up and listen. I'm getting there.
Let go of my ears. I know what I'm doing.
Uh-huh. That's chapter 6. We're in chapter 2. Please hold.
I'm guilty as charged.
Does it really matter who her kindergarten teacher was? Really?
Mm-hmm. Oh, yeah. Or when people are giving you too many facts, it's also okay to say like, okay, like just a few more, like a little bit more objective facts other than her favorite show is Coco Melon. And here's the ranked list 10-1 of all of her favorite characters on the show. You're going to need.
Right.
And again, people have different ways of communicating and different ways of giving a report. And sometimes you have to be patient because they want to give you more details than you want, or the other way around.
I mean, I call it the ICU method of report, really systematic versus the chaotic. And so sometimes I would interrupt and just say, all right, I already know their name, their diagnosis. I've looked up their history. The HOP already read it because I would come in early and do that. What do they need? What's a rhythm? What's on deck today? See ya. Go home. Right.
And it's totally fine to not be berated with questions. If they're like, well, what's this? What's this? And it's all in the chart. Just be like, okay, well, like when you get a minute, why don't you look that up? Because you do not have to answer all of those questions for them. You don't. Sorry, I cut you off. What were you going to finish saying?
Oh, no, that's it. I mean, I just think it's, over time, if you're staff, you're going to figure out kind of what kind of report people give and how you give report as well, because you may be also giving. I know I gave report in ways that some people didn't like because maybe I wasn't systematic enough and was just hitting the high points, and then there was literally a nurse that we had who would just be like, okay, like she just had everything memorized. She never wrote anything down. She really was just like, okay, yeah, you don't even need to give me a report, and I kind of got to that level as well. Like, just give me the high points. And, you're going to get to that level, but you got to read the room. You got to always read the room.
Yeah. When you get to the level where you're like, Well, I'm more of a chatty person probably than it sounds like all of you. When you're like chatting about something totally unrelated for like 10 minutes of the report and you're like, okay, so this patient, yep, all right, yeah, you need to watch out for this. She's going to try to do this and don't let her do that. Okay, great. Bye. See you tomorrow.
Or my pet peeve is, and this is off topic, but people coming in and they're like, they do this and they're reading the chart and they got to check with their friends and pour a cup of coffee. And I'm like, hey, I've been here a whole shift.
I want to go home.
And so when I go in on my shift, my first job on every shift is to get that other nurse out of here. Now, I don't know if they ever appreciated that in all the years I worked, but that was always my first job, is to get that other nurse out of here. You've worked your 12-hour shift. Come here. No, I don't care. Just come here. I'll do whatever you're doing. Your time is up. Go.
Go home.
Didn't always have that courtesy returned to me, but it'd be nice if we could all do that.
And Justine says, I don't mind shutting them down, but then it's awkward. You get used to the awkwardness. You really do. It's like awkward that first time, but then it's fine. It's totally fine. You'll be okay. Any other situations that anyone wants to throw out in the next 7 minutes? Because we'll end at the top of the hour and we'll just troubleshoot it for you. I'll give you the correct answer and then everyone else can give you their opinions. Also, these lovely humans, go follow them. We will link them all in the description of the video. They all have social medias where they share their knowledge with the internet. Chad, what is your social media situation?
I do not have a social media.
All right, we'll get you there. We'll get you there. You and Cal, we'll work on you. Scott and Adrian both do. So we'll definitely link theirs and we can all just harass. Chad, you need to have one. Cal,
If I thought anybody
we're working.
what I had to say.
Well, I think going from the angle of a midwife who's a dude is pretty good.
That's a good angle.
Yeah, I think that's a great angle.
Cal's got a lot of angles too. Cal's got some good hooks already.
We're working on Cal.
It's a very unique perspective. And if you ever did want to start a YouTube channel, that's the nice thing though, Liz, is because you've invited people on here that even if they don't have their own YouTube presence, you're giving them a platform to speak from. So, as you do your interviews with different specialties and stuff, Chad would be a great person to interview. And that's a point of view that people would like to hear from. He doesn't have his own channel to communicate that. So thank you again, Nurse Liz, for...
Oh, well, thanks for everyone being here.
giving the opportunity to share their expertise and their experience. And even if they don't have the wherewithal or desire to do any kind of social media on their own.
You know what I would love to see, Liz, is I would love to get Redonda Vaught on here and just pick her brain a little bit. What would she do differently? What does she think
that would be cool.
All of it is. I feel bad for her and I do love her. I just think she got screwed. She got so screwed. But yeah.
Yeah, that would be cool.
Redonda's she's chilling on her farm.
She is. She's
probably happy about it.
She's like living. I'm like, man.
She kind of needs,
just chill.
She shared a lot, and she needs to just kind of get away.
Understandable.
From all of it.
Just like de-stress and just chill and have her chickens. A little bit jealous, to be honest. We'll have chickens one day. We'll be there. Artful Adjunct says you're also informative. Well, thank you. Chad, the mid husband, is a channel to follow. There you go.
That's excellent.
Go.
That is it, man. You need to snatch that name up before someone else takes it.
Go now. Run, don't walk. Eva says
I'll be the dude wife.
The dude wife.
Man wife.
That was going to get some interesting follows, I bet, initially, until your niche is really specified.
Right.
People might come for different things. So just a heads up.
You had to go there. You had to go there.
Any other situations where you can think of bullying? No one's offering up suggestions, which is totally fine. We can just create our own, where you would need to know how to say something and deflect it off.
I think no matter what, always give yourself time.
Mm-hmm.
And you can always step away. Give yourself time to think, go even to the bathroom, if you need to, if you're heated up. Give yourself the grace of time to consider your response to anything. And just think of the big picture.
Mhm.
I
And
want
it's
to.
hard to think on your feet. It's hard to think on your feet, especially as a new nurse. I mean, we can all sit up here now with the benefit of experience and say what we would say, and say, hey, I wouldn't talk to you like that.
But we would
Yeah.
not have said that as new nurses.
Absolutely not. Would never
Would have
have
been like, okay,
So-
don't cry till you get in the bathroom, Liz.
Give yourself 24 hours. If it's still on your mind in 24 hours, address it. If it's not, it's probably not something to make a big deal out of.
That's really good advice.
Mhm.
The one thing I want to point out before I forget who said it, but like, whenever you address something with humor, it always helps,
Mhm.
right? Because if you make light of the situation with humor, they're like, I don't have something off the top of my skin there, right?
Yeah.
Like,
Yeah.
Here's another nugget I would use, and I would completely make this up. If somebody was just like cranky pants on permanent, I would just say, God, you know what? You remind me of my Aunt Cranky Pants, or my Aunt Judy. She had a big personality like you, and she was really fierce, but I know she had a lot of stress too, and so it's really awesome, like working with you. And then they're just like, what?
They're unsure what to do. They're like,
wait,
wait.
Right. Now they're like, oh, you're going to follow me around. I better like just ignore you.
Yeah. Yeah. And accepting faults. Like when someone says, if they're like, wow, it'll shock you to know that sometimes people are like, Liz, you are scattered. And you just be like, I am. It's a feature of my personality that I am actively working on, and kind of owning it, because it's true. Like we all have odd features, and just like, it used to make me really sad when people are like, wow, you are a mess. Yikes. Like scattered. It took me a long time once I got report down, it was fine, but it took me a minute to get there. People probably hated me because I was like, like spouting random information, and just own it. You know what I mean? Like, and actively do try to work on it, but don't fight it. Like if people call you on stuff and it's true, just be like, yeah, that's true. And then they don't have anything to say. Hey, why didn't you do this? You totally forgot to do this. What were you thinking? I don't know. I'm not sure. I will work on that next time.
Story checks out.
Yeah. And then people probably know. They're like, oh yeah, she's kind of special. Thanks for all my chickens in the chat. At first I was confused. I was like, why are people sending me chickens? You're mentally gifting me a chicken. One day I'm going to have illegal chickens. Next year.
Be kind to yourself and be kind to each other. Don't take the criticism too hard. Give people the benefit of the doubt. It's not easy. God knows I was not successful. And a lot of my social interactions, like I said on one of the other chats, I think I was a really good nurse, but not always a great employee. And
Some people just need to switch to decaf. That's the bottom line.
Don't make us do that.
And whatever you do,
don't make us do that.
Don't hide in a body bag to scare another nurse. Just don't do that.
My
Just don't do that.
No, that's okay. That's okay. Look, if you have never drank apple juice and told someone else it's their like a patient's pee, then
you gotta have fun at work. You have to.
In a urinal, I hope. Just casually swigging it.
I once ate oatmeal out of a emesis basin.
Oh yeah.
That's taking it to the next level, Chad, man.
No, they microwave really well.
Yeah.
Yeah.
Everybody else gagged, but it was funny to watch.
Yep. I have also used a urinal, a new one, as a water bottle, because sometimes you forget them.
It works.
And you plop a little Red Robin down in there as a little straw. Bam. Coup day tip if you want to like have it nice and angled towards you.
On that note,
see what nursing does to you, people. Do you see what nursing does to you?
You
nurses, do you see what you're in for?
Oh, I love it. All right, friends. Thank you so much for being here. Do check these lovely people out. I hope you learned something today. If you did, make sure to do all the likey, subscribey things and give the like button chest compressions an odd number of times, though. That's very important. Thank you, everyone who is a channel member. You are the bomb humans. And I have some rants coming up for you because I have big feelings on a few things. So you can join these people in order to hear them, plus the people we gained today. And as always, remember that you, my dear friends, are more than enough. Even if you're being bullied, just fight back. You can do it. You are not alone. We've all been there. And you can do hard things like fighting back against your bullies. You can do it. You can do it. All right, friends. I'll see you next time. Bye. And Chad, you stay on until the end. Oh, Chad's gone.
All right.
Oh, no. Adrian's
I'm
gone.
here.
She left. Oh, now we have to actually turn it off. It's that
Push
kind of
stop.
day.
There you
It is.
go.
That kind of day.